Hello, my name is Jacqueline Arvez. Today I'll be discussing and walking you through my presentation on what it takes to have the professional qualities of a competent sonographer. Category 1, Appearance. Starting off strong, one of the most important and standard precautions when it comes to patient care is using PPE, also known as professional protective equipment. Some invasive procedures may expose sonographers to body fluids. It is crucial for a sonographer or any healthcare worker to follow the established policies and procedures of applying PPE to help prevent exposure to bloodborne pathogens. Some examples of PPE are gloves. Gloves must be used when handling body fluids. Mask. Masks help to protect the eyes, nose, and mouth. Face shields are also highly recommended. Gowns. Gowns are used to protect the skin and prevent soiling of clothing. It is important for sonographers to wear the correct uniform to maintain professional appearance, ensure safety, and comfort. Some examples of professional appearance are wearing scrubs. Sonographers are typically required to wear short-sleeve scrubs that are easy to wash and worn to work only. These uniforms should be washed daily. Shoes. Proper footwear is another important part of the uniform. Sonographers spend long hours on their feet, so supportive and comfortable shoes, such as sneakers, are highly recommended. Shoe wear requirements vary by employer, though open-toed shoes should never be worn in healthcare settings. And finally, jewelry. In order to reduce the likelihood of harboring microorganisms, jewelry should be kept to a minimum. It is best to wear plain, minimal jewelry and always avoid dangling accessories. Another way to reduce the likelihood of becoming a carrier of microorganisms is to take great care of your personal hygiene. Some examples are your fingernails. Fingernails should be kept short. Any cracked or broken nails should be covered or glossed over. Long or acrylic nails are deeply discouraged. Frequent hand washing and sanitation. Frequent hand washing and sanitation is vital, especially before and after patient care. This will help to maintain overall hygienic cleanliness. And hair. Maintaining a short hairstyle is best. However, long hair can and should be worn up and away from your face, clothing, and patients. Category 2. Ethical and legal aspects. Employees that display positivity, enthusiasm, and go out of their way to do more than what is required of them are more desired by employers. Some ways to show work ethic are by showing empathy, having integrity, maintaining a positive attitude, showing courtesy and respect, and having accountability. Many patients are unaware that a sonographer's job is to produce diagnostic images only. Those images are then read by a qualified physician or other trained healthcare practitioner to establish a diagnosis. Therefore, it is important that a sonographer should never act as a diagnostician for patients. Sonographers who provide diagnostic information may be held liable, as this is beyond the legal scope of practice for our occupation. A major legal aspect a sonographer must abide by is HIPAA, also known as Health Insurance Portability and Accountability, a federal law passed in 1996 that establishes standards to protect patient confidentiality. The Hippocratic Oath is an ancient ethical pledge observed by physicians and occasionally other healthcare professionals, containing basic guidelines for ethical standards between the healthcare provider and patient. Part of the oath principles are still used in most medical schools. Some concepts found in the Hippocratic Oath are placing the patient's interests before your own, protecting patients from harm or injustice, treating all patients equally, respecting patient rights, and protecting patients' confidentiality. Category 3. Written and verbal communication. Written communication skills are essential for a sonographer to have in order to report descriptive information about accurate visual findings when completing ultrasound examinations. These reports are to assist the interpreting physician in making an overall diagnosis. Sonographers must be able to translate these findings into a clear, structured, formal report. Effective verbal communication skills are essential for sonographers because they must clearly exchange important information with patients, colleagues, and interpreting physicians. Verbal communication helps ensure that sonographers can accurately describe their findings to physicians while remaining respectful, attentive, inquisitive, and able to respond appropriately to questions. Strong communication also reduces the likelihood of conflict, since many misunderstandings arise from poor communication. With patients, you'll need to be able to explain procedures in a way that is clear. Knowing when and how to communicate effectively helps to ensure quality patient care. Category 4. Professional issues. A widely recognized credential for sonographers is the ARDMS, also known as the American Registry for Diagnostic Medical Sonography certification. The ARDMS grants professional certifications to diagnostic medical sonographers and other sonography-related fields. For one to attempt the certification examination, you must pay the exam fee and show documented competency in clinical training and clinical training hours. Other documented proof you must show includes successful completion of general, medical, or sonography courses, a transcript of completion of an accredited sonography school, and a government photo ID. Medicine is always evolving. Therefore, it is important to stay up to date and informed about new developments or technologies within the field. Sonographers must actively join the state or national level societies in order to develop/increase knowledge. This ongoing learning activity is also referred to as CME, Continuing Medical Education. So that about wraps up our presentation for today. Here are some sources and links that I've attached to the end of the presentation in case you would like to dive deeper into this information. That being said, thank you so much for listening, and thank you even more for your time. Until next time, farewell.